if you don't mind.
Yeah, of course.
Okay. Now that last part.
So that last CAT scan from December, January, whenever you got seen in this clinic last, had the scarring itself looked, the kind of older stuff looked like it was about the same from the prior scan, okay? But you had some kind of new things layered on top of it, kind of areas that looked a little fluffy almost. They kind of looked very hazy, poorly defined stuff all throughout, mostly your right lung, okay? Now the question is, what is that? It could be progression of the fibrosis, because that's kind of the way it starts. The inflammation that leads to scarring starts as that really hazy stuff, okay, and over time progresses to those scars and that fibrosis. Now that could also be fluid. It could be infections. It could be all kinds of stuff, okay?
I have fluid. They said I do have like fluid underneath the lung.
Yeah, you do have a little, particularly on your left side.
Yeah,
okay?
you said it was probably gel now because it was.
It probably came from right after your heart surgery, honestly, and those are very common. Once you get your chest opened up, fluid collections around your lungs are almost universal. And some people have one that just persists forever and doesn't really cause much in the way of trouble. Okay, but you over the years have had progression of that fibrosis, those scarring changes. All right, and you've had a pretty extensive workup for things like autoimmune diseases, like lupus, rheumatoid arthritis, all this stuff.
Wait, I don't understand.
What they are is they're autoimmune diseases where your body kind of attacks itself, and it can cause scarring like this in your lungs. And the reason we want to know about that is because we have to treat those diseases specifically to slow this stuff down. Okay, and there's no evidence that stuff has happened. Okay, so you very likely have just developed this kind of out of nowhere. There's no real explanation, just from bad luck.
Is it emphysema or COPD?
So no, it's not.
Because I told my sister, I said, I don't think I have emphysema compared to what I've seen.
No, it's not emphysema or COPD. Okay,
that's what Yidri told me it was.
Yeah, so there's a lot of confusion about what those terms mean. Okay, so what you have is pretty significant scarring inside of your lungs. Okay, smoking certainly contributes to that. So the smoking you've done in the past definitely contributed to that. That's 100% the
From
case.
7 years old to 4 or 5 years ago.
Yeah, so that's absolutely the case. The smoking contributed to it, and it kind of accelerates it and makes it happen a little faster. Okay, but what you have is not necessarily COPD, where the cigarette smoking kind of destroys those portions of your lung. Okay, what's happening here is you're developing fibrosis, where your lungs are not nice and stretchy anymore. They kind of start to get hard. Okay, and that's why we're struggling to breathe more and struggling to get oxygen into your lungs, is because those really nicely inflatable lungs that most folks have, yours are significantly more stiff than that.
Okay.
All right.
Now, my mom had a lung disease, but I don't remember what it's called. She knows, but it sounds funny when you say it. Sounds like a cough drop. Altoids. You know what I'm talking about? Yeah, Altoid. My mama had lung trouble.
Was she a smoker?
No.
Not significantly.
No.
It wasn't asthma or COPD.
No.
Right. Okay.
Now. Okay, so you don't think it's COPD?
If you do have a little bit underlying, I don't think it's the primary issue. Let's put it that way.
Is it still going to do like the 4 stages?
No, so this is staged differently than this. There's really no specific terminology of this is.
So this might not actually kill me.
Stage. So
I was thinking it was going to take me out after.
The issue is, so we need to put a caveat on this, is that pulmonary fibrosis, this scarring, can and often is more serious than COPD.
Oh.
Okay? The thing is that from everyone's fibrosis or everyone's lung scarring behaves completely differently. Okay? So some folks develop little bits of it. We monitor it for years, and it shows almost no changes. You've had some slow changes over the course of the last handful of years. Okay? Which makes me believe that over time, if we give this another 10 years or more, that you will have continued destruction of your lungs. All right? Now, we tested you for all of those autoimmune diseases, okay, and nothing showed up, okay? So there's not one specific disease we can treat that we could say, I think this is what's going on and we're going to slow it down like this, okay? Yeah. What we have with folks who have unexplained scarring of their lungs or pulmonary fibrosis is there are certain medications that are designed to slow that process down, okay? It's not, we cannot completely stop this disease in its tracks, okay? But it significantly slows the progression down, okay? There's two medications. One of them is called Ofev, and one is called Esbriet, all right? By and large, they're tolerated really well, okay? You can have some increases in your liver enzyme numbers, so you need periodic checks for the first handful of months that you're on it, okay? And the biggest side effect, okay, is that folks can get upset stomach and particularly diarrhea, okay? It's unpredictable. Not everyone will get it. Not even most people will get it, okay? Some people will get a little bit of it and it's tolerable. Some people I've seen have to stop it because the diarrhea gets so severe, okay? There's no way to know which category you're going to fall into. Smart money is that you probably feel just fine, not have any issues with it. Okay.
Now you think you say it didn't make you better.
Smart money, and because overall most people don't really have issues with it. The ones that do, though, it can be rough. All right. So that's one thing that I'd like you to consider.
The only thing I have a problem with new medicines is I'm so damn scared. Mm-hmm. I hate taking something new. Mm-hmm. Hate it, hate it, because when you start taking something new, you start oh, I don't like this. I don't like this. And you're in that trip for a little till the medicine goes away. Yeah. And that's what I can't stand. Yeah. And everybody has to go through that.
Yeah, these by and large, like I said, these medications are tolerated really well.
They are kind of mellow.
They're pretty mellow. The only thing you could run into is issues with the diarrhea.
Okay?
And the liver enzyme related stuff, you won't even feel that. We would just notice it on your liver enzyme tests and just say, hey, we need to back off for a couple months and drop your dose. So that's the only thing you notice, okay?
Now, unless the diarrhea gets out of hand or it's even a problem.
And if that's the case, you just call us and be like, sorry, we got to stop it until you...
Well, with all the medicine I'm on, I have trouble being backed up, so that might kind of help me out.
Sure, and I've seen that too. People just say, no, it kind of makes me feel a little more normal because it helps move my bowels a little bit. So we don't absolutely have to start this now. If you want to go home, if you're going to write down medications and you want to research them, it seems like you kind of like to do that and think about it, that's okay. You can just give us a call back, okay? It's totally up to you, all right? There's not a hurry. If you want to take a couple weeks to think about it, if you honestly wanted to say, hey, look, I want to get one more CAT scan in 6 months and say, look, if there continue to be changes, then we say,
I don't know if I have to.
We're backed into a corner.
It's going kind of.
I'm sure you say you can agree in the last 5 years you've probably felt slowly worse.
Oh yeah, I can tell you the day it changed. Mm-hmm. I woke up and I went through a whole day of this weird new. Yeah. It's kind of worse, and that was it. It never got better since then.
Continued to get
so I know the day it changed. Now the day before that, I could go days without. Some days actually not having too much trouble.
Yeah.
But like just getting up and walking. But mostly when I carry something like just a bag or a little 6-pack or something.
It's a really common.
A bottle of Coke or a 6-pack of Coke. I could walk from here to there with it, and it I guess just pull in.
Yeah, so carrying stuff is a common complaint where folks struggle.
Now I do have, I forgot to tell them a while ago, I do have a lot of phlegm. Mm-hmm. And like I'll talk and it'll get to where it kind of gets in the way and I gotta, excuse me, and then I gotta do that constantly because my voice gets rusty. It ain't gonna be long before I have to do it. And I gotta go make some noise. And now it's getting to where the phlegm's worse than normal. It's like a lot of phlegm. It's like glue.
Do you have dripping from your sinuses, or do you struggle with sinus-related issues?
Well, this right here, they put me in water. You see, it's so stopped up. I gotta constantly blow it and clean it out. And I'm constantly having trouble with
So you have some just kind of stuffiness up there.
Yeah.
Was that before you started on oxygen too?
No,
You
it
always
wasn't
kinda had
like,
some
no,
sinus
it's
issues?
this is what's doing it.
That's what's doing it.
That's
Okay.
what's making my dent, and might be what's making that patchy stuff.
It's not quite. No,
No?
this looks different than that.
Okay.
There are some issues you can run into with regards to almost asthma-like symptoms where you have significant stuffiness and it can cause some things, but it looks different than this.
Yeah.
Now, let's go ahead and so it's just sinus congestion. You're not dripping in the back of your throat or constantly clearing your throat like that.
Constantly clearing my throat. Yeah.
Start you on a couple medications. See if we can dry you up there. Okay. Have you ever used Flonase before? It's a nasal spray.
Yeah. I want to say I was doing it, but I
Stopped off.
yeah.
So what that is a steroid that just acts in your nose to help reduce inflammation. Okay, because what happens when your sinuses get really inflamed is they secrete a ton of fluid, and that's where that fluid drips backwards and can basically everything is so swollen in there from all that fluid that it makes it difficult to breathe, and that gives you that kind of stuffy sensation.
They give you a headache too.
Yeah, it can absolutely.
'Cause I get headaches.
Headaches all right here.
Yeah.
Yeah.
Okay.
We'll start that, and then another thing we can work on for clearing your sinuses up is just an over-the-counter antihistamine like Claritin, Allegra, Zyrtec.
They were giving me
all that stuff.
Claritin, but I don't know why they stopped out.
One of the issues is that some insurance companies, you can sneak it through for them for a while, but since it's an over-the-counter medication, a lot of them won't pay for it if it's an over-the-counter. We can send a script in and give it a try.
Yeah, because I think my doctor just didn't redo the script.
Well, we can send it in.
Because I forgot to call the. It might not be their fault.
We can send it in. If they'll pay for it, they'll pay for it. If they won't, then.
That's
Sounds good. Well, let's try those two, and I think those will help dry up a lot of this stuff and make it a little easier for you to breathe.
Okay. All right.
You're welcome to take a little time. We can write the medicines down for you if you want, and you're welcome to take a little time to think about them if you want. Just give us a
It
call.
won't take me long. I could look at it,
No problem.
check them out, and call you
No problem.
tomorrow
Here,
or something the next day.
I don't even know. We might even have.
Pamphlets.
Yeah, we might even have. All right. These are the two medications. In general, I prescribe folks OFEV. They tend to be a little easier to deal with.
And these I could take with all the medicines I'm taking now.
Take them.
Okay, and they don't have no like severe death side effects or nothing.
That's always going to be reported as 1 in a billion, but no, nothing major.
Okay.
The stuff you have to worry about is we'd have to check your liver function testing, and then we'd have to watch out for that diarrhea. But the only way to know about that is just either going to come or
To
it's
do
not.
it.
So, yeah, here it comes.
Is that kind you could break and try half to see what it does?
No, generally no. There is a reduced dose, but not early on.
Because I like to see what it does.
You're not going to feel any different. So that's the thing. Is this is not a medication that's going to make you feel different. What this medication does
I like
is
that.
it prevents the progression of the fibrosis long term. So it's to stop everything where it is. Okay.
So it don't work on anything to make you like.
It's not going to make you feel better at all. Okay. It's going to prevent you from getting or slow the rate of progression and try to prevent you from getting worse.
But does that medicine kind of make your heart throb or make this or make that?
I haven't had people complain.
That's
of
the
that.
kind of things I hate.
No, I haven't had people complain of that.
Okay, good,
No.
good. Then I'll call you tomorrow and tell you which one. But yeah,
Yeah, no, you're
I'll
good.
probably
Why don't you
definitely.
lean forward for me, bud? Deep breath for me. How's it swelling in your legs?
It's kind of it gets there.
Comes and goes. You take water pills still?
Yeah, Lasix.
Yeah.
Still on
You
Lasix.
feel like it does a good job of keeping water off of you or not quite? Do you get short of breath when you lay back?
I keep you in, but I still have fluid.
Yeah. Yeah, so do you get short of breath when you lay flat? Do you have to prop yourself up on pillows or no?
Yeah.
A little bit.
Now, sometimes I'm laying down. Sometimes I gotta actually sit up to catch my breath.
Okay.
And then sometimes I gotta actually stand up and lean over.
Yeah. Do you feel like that's getting better or it's about the same?
About the same.
About the same. Okay. So I still think you probably need to be on that fluid medication. Keep you from building fluid back up again.
Okay.
Because there's a difference too. Even if you're doing well from a fluid perspective, you still might need to keep it off. It's not just
Okay,
a once and
I got
done
you.
thing. All right.
Okay.
think about those. We'll have it might take probably a couple weeks by the time all the approvals get done, all the paperwork gets submitted, all this jazz. So it's certainly not a huge hurry, but just let us know what you decide, okay?
Okay.
Sounds good?
All right. Which one you would think
I
would
would
be
grade
better?
for the OFEV. Yeah, that's the one I would give
I
you.
noticed you said that first.
In general, they tend to be a little bit easier to deal with. I mean, getting their approval was pretty easy. So
Okay.
sounds good.
All right. I'll definitely check it out.
Absolutely, my friend. And just again, call back, take a couple days if you need to, because it seems like you want to at least try to research some of this stuff beforehand. So that's perfectly fine.
Okay.
What we'll do is, regardless of if we start you on anything, we'll see you again in 6 months with a CAT scan.
Okay.
Sounds like a plan?
Yes, sir.
Cool.
All right. Thank you, man.
All right, dude. Hold
Appreciate
on one
it.
second.
Nice
Let me
meeting
let
you.
Krista know what's going on, and we'll get you out of here, okay?
Okay, brother. Thank you, man.
Yeah.
Nice to meet you.
Nice to meet you, brother. Take care. Thank you. Do you believe this shit? Do you believe this shit? I'm glad I put it recording because you would have never believed me. And you would have said, oh, he's saying something wrong. Because hell, I barely believe it. Man, what the fuck, dude? Love you.